So good day everyone, I am Rhea Putong, a student nurse from Section 12E of Davao Doctors College. So in this video, I am going to perform female catheterization. So this is the introduction of a catheter through the urethral meatus into a patient's bladder. One of the purposes of this assessment is to assess the amount of residual urine if the bladder empties incompletely. So the materials that we need in this assessment is a Foley catheter, right here. Next is a urine bag, and also a catheterization set. So prior to the conduct of the procedures, I have checked the doctor's order for catheterization. So this is done to ensure that I have the right patient and right procedures to be done. And of course, I will be performing hand washing in order to prevent the spread of microorganisms and prevent contamination. So good day ma'am, I am Rhea and I will be your student nurse for today. So may I see your wristband ma'am? Please state your full name. And how about your birthday? Okay, so right now, ma'am, we already know that you have urination issues, which is difficulty in urinating. So Dr. Gomez has ordered that you will be receiving a urinary catheter. So for you to eliminate your urine, so I will do this by inserting a tube through your urethra and connecting it to your bladder. So therefore, you will be experiencing some discomfort later when I expose your genital area. So are you okay with that, ma'am? Okay, so good. So do you have any questions or clarifications before we start? Okay, so as you can see, ma'am, I have already closed the door and the curtains in order for you to provide privacy. So now position the patient in a dorsal recumbent position with flexed knees for us to allow a clear view of the meatus where the catheter will be inserted. So for us to know when the bladder is higher than the catheter state, so the gravity will also help the pee to flow. Next is to drape the patient, exposing only the area to be used. So now, ma'am, I am going to expose your genital area. So I am going to place a pad underneath you so that we can prevent the bed linen from getting soiled. So can you please raise your buttocks, ma'am? Okay, so next is to provide a direct light for the visualization of the genital area. So next is I have already opened the tray, which is my catheterization set, and arranged these equipments to avoid contamination of the sterile items. So here I have my sterile forceps. Next is my sterile gloves. Next is cotton balls. Next is a betadine. And also a lubricant. An eye sheet. And also a 10cc syringe with refilled water. So next thing we need to do is to cleanse the area using a sterile forceps with a cotton ball and betadine. So first, we need to cleanse here in the midline. Next is in the side. Also in the side. And discard. So after that, we need to perform hand hygiene. So after this, I will be putting my sterile gloves. in my left side. And position it clearly. So after this, I will be putting the eye sheet. Okay, so now as I am going to connect the catheter with a pre-filled syringe. Okay, so next is to lubricate. So next is to lubricate the catheter for about 1 and 1/2 inches, being careful not to pin. So next is to lubricate the catheter for about 1 and 1/2 inches, being careful not to plug the eye of the catheter in order to reduce pain upon insertion. Okay, so next is I am going to put the tray here. So I have already put here. I'm going to pick up the catheter with one hand and place on the other hand on the labia minora and separate and pull up gently. Okay, so I am going to insert the urinary catheter, ma'am. So yes, please relax. Okay, so insert the catheter into the meatus for 2 to 3 inches or until the urine begins to flow. So rest the hand in the pubis area while holding the catheter in place to prevent the pulling and pushing of the catheter because it may cause an infection to the urethra. So if a specimen needs to be collected, pinch the catheter with the thumb and the finger while placing the specimen container in position. So next is to connect the catheter to the urine bag, making sure that the urine bag is closed to prevent leakage and maintain the sterility of the connection. Okay, so next is to inflate the balloon with 10 cc of sterile water. So the balloon will prevent the catheter from slipping out of the patient's body. So now I am going to take the catheter on the patient's thigh. So allow some slack of tubing to accommodate the patient's movement. So we will be going to remove the eye sheet. Okay, so we will now discard the unnecessary items. Okay, so we will now place the patient in comfortable position. Okay, so ma'am, how are you feeling right now? Okay, so good. So after doing the procedures, so do the aftercare of the equipments and also record the time of the procedure done, amount and color of initial output. So we will be discarding the sterile gloves. And discard it and perform hand hygiene. So that would be all for my return demonstration in female catheterization. Thank you.